and I would like us to know that YP-LEF is a recorded session here on Zoom. So if you're just joining us, we're happy to have you here. However, this session is recorded, and if you don't want to join us while it's recording, that's okay. You can always head over to our YouTube channel YP-LEF and join us live from there. It's the YP-LEF Enlightenment Forum, and we'd like our friends to join us here as we kick start this show. Now, tonight's topic is, as I've said over and again, and you're wondering why, yes. So tonight's session is going to be educating, and it is a topic for everyone, cuts across all boards, youth, young professionals, even as an adult, because this is something that we do need. Tonight's topic is autism, understanding the stereotypes, or understanding the spectrum rather beyond the stereotypes. Autism, understanding the spectrum beyond the stereotypes. But before we go on and introduce our facilitator, who has graciously joined us, I'd like to know one more time where we are coming from. I can only see about 3 persons in the chat. Okay, someone is joining us from England, UK. You're welcome. We love to have you here. John is joining us from Ikorodu in Lagos. Hello, our fellow Lagosian. Who else is joining us, please? Let's know where you're joining us from. Understanding autism as a spectrum beyond the stereotypes. All right, so I'd like to introduce our facilitator here. She's been with us since the beginning of the session, and she's someone that knows her onions in that way. Her name is Ugo Ukaude, and she's a dedicated and experienced behavior specialist with over a decade of hands-on experience supporting children and young adults with autism and related developmental disorders. She has worked extensively across schools, centers, and home-based settings. She has consistently delivered individualized, evidence-based interventions that promote meaningful learning, skill development, and independence. Her work is centered on helping individuals with diverse needs and develop functional, social, and adaptive skills that support successive integration into society. She's deeply committed to creating lasting impact by empowering children and young adults to reach their full potentials, challenge limitations, and thrive beyond societal stereotypes. Driven by passion and purpose, she brings both professional expertise and genuine compassion to her practice. Well, our facilitator is grounded in mass communication, that's her background, and other certification in applied behavior analysis. She also has a diploma in special education and speech and language. And she's also a student of the University of Port Harcourt, where she's also learning again communication and disability studies. Ladies and gentlemen, it is my pleasure to invite up on stage our well-seasoned facilitator in the person of Ugo Ukaude. Please let us see your welcome. Let's see your welcome in the chat session. Just tell her you're welcome. So, Miss Ukaude, you have the floor right now.
Thank you, Ms. Rosemary. Thank you. A big thank you to YP-LEF for this beautiful opportunity to share in my knowledge. And I'm happy that I'm here. And I hope that at the end of this session, would all be well informed and understand better what it means, what autism is, what is not, and how best to handle and deal with children and young adults with autism. So, but first, so let me go ahead and share my slide, and then we'll take it from there. Thank you once again for having me. Okay, I don't know if everyone.
Yes, we can see your slide. We can see your screen rather.
Sorry, just give me a second. Okay, good. So I want us to, as much as possible, make this a very interactive session. I'll need the questions in the comments chat box. Make it active. Drop your questions or comments as it comes to your mind. We'll try as much as possible to answer all the questions or clarify what needs to be clarified in the course of the session. So I'd first ask, so what comes to your mind when you hear autism? Let's talk about it. What comes to your mind? Drop on the chat box what comes to your mind when you hear autism. What do you think of? What comes to your mind? So please, like I said, we're going to make this as interactive as Zoom and YouTube can be. So just drop it. And Miss Rosemary, please just draw my attention to the chats as they come, in case I miss anyone. I'm here, I'm looking at it. So I'm waiting. Okay, Peace said there are some that shouts and it pains me. Okay, so that's what comes to your mind when you hear of autism. Difficulty in relationship, okay. A neurological disorder. Nice one, Miss Promise. Neurodevelopmental disorder. Good. Good. So just keep it coming and then we'll see. Not being able to interact normally. Thank you, Caleb. So let's go. So what autism is a developmental condition. It means it's something that happens in the process of development. It's not, most children born with autism weren't born. It's not something that you see at a glance once they are born. You say, oh, this child has autism. It's not something that once you see a child with autism, you know. No, most times autism doesn't have a look. Autism doesn't have a face. So it's a developmental condition that affects communication, behavior, and behavior. It affects how they communicate. A child, or we're looking at children now because children with autism will grow up to become adults with autism, right? So autism affects how they communicate. Most people with autism would talk or have issues with talking. They may be able to talk and not be able to express themselves functionally. They may be able to talk and they don't understand sarcasm, understand implied statements. And then autism is a spectrum. The word spectrum means a broad range of similar things or quality. So when we say autism is a spectrum, it means it affects, they have similar traits, but it's completely different. It means, oh, one person could be at one end of the spectrum and another person could be at this other. It's similar. The traits are very similar. So for the person that said it's a neurological disorder, yes, you're correct. It affects communication, yes. And somebody said sometimes you scream, they scream and you don't like it. Behavior sensory, maybe. And then somebody else said it's having issues with communicating or behaving normally. For me, I would usually look at autism as a different way of seeing life, okay? So the autistic person sees life or understands life or perceives life differently from how we see it. But the truth is we don't actually know who is the, in quotes, sane one or who is the normal one, like some people would want to use the word, but nobody's abnormal. So we don't use that term when describing people. So we say why spectrum? When we say autism is a spectrum, what do we mean? Okay, we mean that every individual is different. If you meet one person with autism, you've only met one person with autism. I can give scenarios. I can give scenarios. I've met autism that in my over 11 years of being on this field, I see one trait, I'll be like, is this one still part of autism? Like, where is this coming from? I've seen severe head banging, like severe head banging that looks for six edges of hard surfaces to get impact on her head. I've seen autism that is almost like, no, it's not there. I'm like, oh, okay, is this part of autism or is something different? So it could be different persons. So if you've met one child with autism or one person with autism, you cannot use your experience with one person with autism to say this is the face of autism. Like I said earlier, remember, autism doesn't have a face. Autism doesn't have a look. So your experience with one person with autism is just one part of what you've experienced. And everybody with autism has different strengths and challenges. One person with autism might be hypersensitive. Another person with autism might be hyposensitive. So their challenges are different, so as their strengths. One person with autism would be so quiet and not be able to communicate. Another person with autism can communicate too much. In the office to say, this one has talking autism, the autism that talks non-stop. But what people tend to see and classify as autism most times are people with autism that don't know how to talk. But there's autism that talks too much. There's autism that does not know when to stop. There's autism that can tell you how somebody is, how my mommy did not give me something at home, and then he's just talking and talking without understanding boundaries. Where you know that there's something wrong is when the person or the child doesn't know when to stop, doesn't know what to say, does not understand that, I'm not supposed to say beyond the certain point. I'm supposed to hold it at this point. I'm supposed to say this and not say that. But because, like we said, it affects differently, and how the autism affects this person at this stage is that they talk nonstop. They don't understand it. But the other person would be quiet and sit down and not want to associate with people. But there's the overly social autism, the autism that is everybody's friend. So they have different strengths and different challenges. There's an autistic person we had that could play the keyboard, and how did the music teacher put it? He has an ear for pitch. A bit pitch, ear for pitch sound. I don't know what it is in music though, but he can literally play back anything you give to him. Like he hears you playing one song and he gives you on the keyboard, not learned, and that he draws really good. But there's an autistic person somewhere that does not know how to hold the pencil, that's struggling with fine motor skills or gross motor skills. So it differs and it varies. So no single definition fits all. Like I said, you can't use your experience with one person with autism to define or generalize autism. You would be making a huge mistake and a disservice to other persons with autism. There are people on the autism spectrum that would need support all through life. They would need somebody by their side. They would need somebody to help them with activities of daily living, not because they've not been taught, but just because it didn't just stick. But there are some that would need little or no support at all, and they will be able to function and integrate into the society. We see them in the likes of Temple Grandin, who is a professor. There are lots of self-advocates now for autism that are able to come on stage and give presentations and talk about their experiences with autism. But it is just their own experience and doesn't generally describe autism as a whole. So let's get that clear and not stereotype autism and say this is autism. People with autism cannot talk. People with autism cannot move. People with autism does not know how to make friends. People with autism, no, it doesn't work like that. They are different and have different, like I said, different strengths and different challenges. So we're looking at myths versus facts. So first is all autistic people are the same. No, that's not true. Autism is diverse. Like I said, in my over 11 years of interacting with people, children, young adults, adults as old as up to 30 years old, I've interacted with a lot. And autism keeps unveiling itself. And then the autism, a child at 4, the autism you see is most likely different, not most likely, almost always different from the same child with autism at 10, same child with autism at 14, same child with autism at 18. You're dealing with completely different child at every stage of their journey. You're dealing with it because, like I said, autism is diverse. It is not, I'm looking for a medical issue now that you say, oh, you see this is malaria. Malaria is like this, is malaria. But autism is not. It's diverse. The way it affects A is different from how it affects B. So all autistic people are not the same. Autism is caused by bad parenting. I see this a lot. I hear people say this a lot. I hear people even in the education sector, is this woman that is not handling her child well? If she handles the child well, even the autism will behave. It's not autism again, it's bad parenting. But it is not. It's a neurodevelopmental condition. It's something that the parents don't even have control over. And most times, nobody sets out to have a child with autism that you'd say they intentionally want to encourage the behavior, or they intentionally want to make the child be so dependent on them. I understand the fact that sometimes some parents might not know when to draw the line between when a child is being a child and when it is a diagnosis. That's different, completely different. But autism is not caused by bad parenting. No, there's no known cause for autism. It's been linked to a lot of things, genetics, environmental factors, and all of those, but there's no known cause, because when the cause is known, maybe there will be a solution. There's no known cause for autism. And also there's no known cure for autism. There's no cure. What we have is what we call a treatment. It's like teaching them how to better handle themselves. You're not curing them. It's not a disease. Most times, even self-advocates of autism these days are quick to say, no, don't fix us. Don't fix us. We're not broken, right? Don't fix us. We're not broken. But what we're doing is, okay, you have challenges with this. How do you better manage yourself so you don't come out looking socially awkward? So stuff like that. What are the common signs of autism? What do you see? And then you know, okay, that this is tilting towards autism. There's social and communication challenges. There's restrictive and repetitive behavior. And then there's sensory sensitivities. We're still going to look at this one after the other. So we are here. So social and communication challenges. Autism spectrum disorder, ASD. So most time when you come across the word ASD, I'm sure you just keep here knowing that it's autism spectrum disorder. Affects both verbal and non-verbal communication. When we talk about autism, most times people feel it's just the verbal communication. It's not just verbal. It affects both verbal and non-verbal communication. So this means that sometimes, especially in early stages of autism, what most parents say they notice is little or no eye contact, no response to name. You scream and scream, you're calling a child's name, the child isn't, it looks like you're not, the child cannot hear. So when they go to the hospital, the first thing the doctor wants to do is to check if the ears are okay, or can the child hear, to what extent can the child hear. And most times, if not all the time, when those tests are actually done, the children come out clean, like there's nothing wrong with their ears, they can hear you. So it means nothing is wrong with the ears. So they are not able to probably process the information well enough to respond. So that's where autism affects them. Trouble initiating conversation. So some of them don't know how to initiate conversation, to come to you to start up a conversation. They're not able to come to you to start up a conversation to say, so do you know that today in school, sorry, what's going on? This was maybe, sorry, I think I messed up with my slides, but I am still here. Okay, sure. I'm back. Thank you. So trouble initiating conversation, they're not able to start up a conversation. You know how you have like a 6-year-old come back from school and tell you, you know what, today in school, this person did that, and then my teacher said that, and no, they're not able to. Maybe after a while with teaching, they're able to tell you, but they will still need some level of support to either prolong the conversation or know when to stop, know when to start a conversation, know when to pause for the other person to talk. So all of that. So understanding metaphors and sarcasm now is almost always a problem. Our children take things literally. You know how your mother, I don't know, my own mother will send you on an errand and then you now come back and say, Mommy, where do I put the book? And she says, put it on my head. Our children will put it on your head. Literally, because that's how they understand stuff. They take things as literal as they come, as they very literal. So an, an autistic person that is very verbal would tell you, why are you so fat? They don't know how to sugarcoat issues, to tame it down a little. They say the truth as it is. They just tell you straight up. They don't understand. You know how they say, go through the corners. No, they don't go through the corners. They come pretty straight and they tell you as it is. They may have challenges interpreting body language. Being able to understand non-verbal cues. So, you know, when we said autism affects both verbal and non-verbal communication, you know, that cutting of eye, our parents will, or that look that they will give to you, and you know that it means you should couple yourself, or you should not take that thing from that auntie. Don't take that food. Our children would have struggles with understanding it, but they do after a while. We worked with a child that would want to crash things, and he now understands that if I turn and look at you, you know that you should not throw away that thing. Or he does it and he attempts to put it back. They get to understand that after a while, after training and therapy, they build those skills. So nothing is impossible with our children. That's what we tend to say. They can learn like every other person, but just the process that makes it a bit different. Then there's restrictive and repetitive behavior. So they show some behaviors that are not very typical, like hand flapping, hand movement, looking from the side of their eyes, tweaking their ear, doing something that is constant, repetitive. They do it over and over and over, and it tends to look like they don't particularly have control over it. So, and these behaviors would happen maybe when they're excited, anxious, but at any point in time, they particularly do not have control over repetitive movements and repetitive behaviors. Then intense or rigid interest in specific subjects or objects. You see a child that is overly interested in maybe animals and or numeracy, and every other subject is a no-no. The child is so fixated in one aspect and refuses to take a look at every other aspect. So we had a child then that was so fixated on animals. So you use animals, 1+1, instead of saying one plus one, you say an elephant and another elephant. How many elephants do we have? You start to teach him because he was so fixated in animals. So, or numbers or cartoons or something. So the child is fixated in one aspect, and every other aspect of learning or of life is left to suffer. And they are distressed over minor challenges in routine or schedule. They like things to follow a particular order. There shouldn't be a change in it. And when there's a change, they get distressed and really anxious. So we had a child that would line up objects, trying to look for things to line up. So line up, line up, line up, like that, like that, like that, in order on a straight line. And then if you take one out, the child can have a massive tantrum or meltdown rather, a massive meltdown that the child can go on and on and on and on and cry for hours on end, because it looks like you've taken something out of order, something, you've changed my schedule, you've changed my routine, you've changed my plan, or you're going home and then decide to, we're used to going straight, you decide to now, maybe there's traffic on this side of the road and you decide to pass another side without telling the child. The child gets so anxious and throws a serious tantrum, and it looks like my world is coming to an end. That's what happens. These are signs that tells you, oh, okay, this child is tilting towards autism. And then sensory sensitivity, highly sensitive or insensitive to light, sound, smell, or texture. Oh, there's a certain kind of clothes that I don't like on my skin. There's a certain kind of I don't like the labels to touch my skin. I don't like, overly sensitive. You turn on the the blender and the child is closing his or her ears because the sound is too much. Or it's even sometimes you're breaking down this house and the child is in one corner and doesn't understand that anything is happening. So it's on two ends of it, right? It's either high or too low. So we should understand that it's two ends and not say, oh, it does not like. Meanwhile, there's this one overly likes, right? And then there's some that would want touch and squeezes and hugs. There are some that don't like you. Don't touch me, don't touch me, don't touch me. There are some that want, oh, I like, even as much as taste, right? I like strong. The other one would like soft. I like crunchy. I don't want crunchy. You understand? So there are different ends, highly sensitive and insensitive. They don't even know. They can have a big injury and be bleeding and they don't feel it, like there's nothing. And another child might have a small injury and it looks like my hand has fallen off. So there are two different ends. Unusual eating habits, I think I mentioned that at the other one before. Sticking to a particular taste. We had a child that would only eat a particular kind of rice, bland rice, color. If you add crayfish or he sees one grain of beans inside the rice, he will not eat it. Or he likes his water, his food would be very hot, then his water will be very cold. So there are two different ends. Then there are strengths, okay? Our children most times have attention to details. They are able to see things that you might actually overlook. They have good memory skills. They're able to recall things as far back, especially when it's been built over time. Honesty, I give it to them. They don't know how to go through the corners. They tell you as it is, straight up. And then unique thinking patterns. For the ones that are very, very expressive, when they think of things and then the way they respond to you, be like, oh, okay, actually didn't look at this from this angle. So they have that strength. And then let's understand behavior. in dealing with children with autism, we have a rule that we say the dead man's rule, and it's a good way of understanding behavior. The dead man's rule is anything a dead man can do is not a behavior. I know once a man is dead, he cannot do anything. So it means that everything we do in life is communication. You're all muted, and then you're communicating. You're telling me that, and you're listening to me, right? Your video is not on, but I know that you're at the other end and you're listening to me because you're muted and you're paying attention. So every behavior a child, if you understand that, if you understand what behavior is, we're better able to handle a child, even when the child is non-verbal, even when the child is not yet using words, rather, to communicate. We understand that we understand the unspoken words through gestures, through different means. You understand what this child is doing, is trying to say, and then you're better able to handle the behavior or handle the child. And we're not quick to assume that, that's how he behaves. He's always crying for no reason. No, nobody cries for no reason. When a child is born, the child cries when the child is coming out because, I've been taken out of my comfort zone, right? When a child is hungry, nobody teaches a child to cry for food. The child cries and food is given to the child. Over time, the child understands that if I cry, I get food, right? So that is a means of communication for that child to get access to food. So if you understand that every behavior is a means of communication, we're better able to handle behaviors when they occur, either good or bad. Meltdowns are not tantrums, okay? We should be able to differentiate between when a child is having a meltdown or when the child is having a tantrum. And how do we do it most times is check antecedent, behavior, and consequence, the ABCs, right? The antecedent is what happens before the behavior occurs. The behavior is the behavior itself, what happened. And then the consequence is what happens after the behavior had happened, okay? So for meltdowns, most time is as a result of overload, frustration. I am tired, I am overwhelmed, everything is just too much for me, and it's like a cry for help. Help me, I cannot do something about this. But for tantrums, most times it's a tussle for power. I want control. I don't want to do this thing that you said I should do. And the best way to do it is to scatter this whole place. I'm going to tumble this table. I'm going to throw away this chair just to prove to you that I will not do it. And the way you handle meltdowns will be completely different from how you handle tantrums. So we need to understand that. Then the triggers could include overload, sensory overload, and frustration. Most times you just see a child sitting down and all of a sudden, maybe you bring one mass work like this, that the maths, in the child's head, the maths is not massing at all, it's not entering, and then you just see the child crying. This is just too much for me. I can't. So, and then that's not the time to be quick to say, you must do this work, you must. No, you calm down, talk to the child, understand, and then gradually break it down, make it easier till mastery is gained. You don't just pack load. For our children, most times we'll say, break it into smaller chunks in bits and pieces and keep building and building and building. Over time, you gain mastery. Now let's look at what the role of the society is in handling autism. If there's a lot of awareness, now, I believe, I want to believe so, as opposed to how it was 10 years ago or 15 years ago. A lot of people are talking about autism. A lot of schools are becoming more inclusive. A lot of churches too are having small Sunday school units for autistic children to still be part of the church. So there's a lot of awareness. And if there's a lot of awareness, there's a reduction in stigma. Trust me, there are a lot of parents with children with autism and maybe other disabilities that don't come out to talk about it because the way the society looks at them, it looks like them as a failure. oh, you didn't do something right. Oh, this could be as a result of one bad thing you did in your former life. Oh, you were like this. That's why God punished you with this child. So people don't want that stigma. So they hide their children. Their parents that have like 5 children, and it's only 4 the world knows. The world does not know of that one inside that is locked up and doesn't come out because they don't want stigma or how the society will see them. So the goal is for us to have so much awareness that there's no stigma. So much that if a child is acting up at the bus stop, you're not looking at the mother to say, you'll not knock that child on the head and give him sense. No, you should be able to be more empathetic and understand. And if you're empathetic, it means you're putting yourself in the shoes of that parent, because anybody can have a child with special needs. There's no known cure. Before we used to think, well, it was just like Down syndrome, like age and all of that. But these days you're seeing parents of 20s giving birth to children with needs and all of that. So it means that anybody. And as we grow older, as we interact with people one way or the other, you'd know somebody that knows somebody that has a child with autism. You would one way or the other, it's entering your circle, not because I'm a professional, I get to see them, no, but because somebody I know, oh, please, oh, this person's child is showing signs. Oh, somebody's sister. Oh, your sister. It could be anybody. So we should all learn to be empathetic. We should learn to accommodate them. We should learn to include them. And it's so refreshing to see what they can do. A lot. Like they keep, those of us in the autism community or in the therapy field will tell you that our children they keep surprising you all the time, because you see them doing things that society actually didn't think they would be able to do. You see them solving equations, solving mathematical problems. You see them being so good at arts and all of that, and dance. I was excited when a parent sent me a video of a daughter that was autistic performing at Disneyland, a dance show, front row. I was ecstatic. If there's any word more exciting than that, that was how I felt, with goosebumps all over my body. And I was like, this is a child that could barely talk like a straight line without echoing scripts and all of that. But see her performing on stage in her element, you could see that that was like a happy place for her. So if the child wasn't included, you wouldn't see that part of her. You just assume that she's not able to. So inclusion improves outcome. When you're able to get them in to participate in activities that they tilt towards, not what you think they should do. They have a say. Okay, choice matters. You see it in their eyes, you see it in their responses, the way they react to certain scenarios. So that would give you an idea towards what they tilt towards the most. Like, is it music? Is it arts? So you include them in those activities. Everyone has a role to play. We all have a role to play. And it's not just for professionals or therapists. Everybody, I want to believe that at the end of this session, anybody that lives here will live here with the knowledge that if I see somebody behaving, I shouldn't behaving in a certain way. I shouldn't be quick to conclude or to judge. I should be more empathetic, to ask questions, say, how can I help? Or what do you need? Do you need something to just show some level of concern, as opposed to being quick to just judge and conclude. How do you support? Okay. Be patient. Use clear communication. When you're speaking to a child, especially when it's a child with autism, you're not giving bulky instructions. You're not saying, go to the room, pick up the blue chair that is beside the bed and bring it to the room beside. That's too much information at once. Use clear information, one step at a time, based on the level of the child. So you go to the room and let somebody else be in the room to give another instruction. If you see that the child has mastered to that certain level, you go to the room and bring one item clear and positioned in a place where it's easy for the child to locate. Most times, from when instruction is given to the point of execution is where it looks like there's a break in connection. The child would move, actually. Most times you see our children move from point A and they are going. As they are going, they are close to point B. And then something else calls their attention and they just deviate. And then sometimes they shock you. You send them and they go and they come back like, oh, nice one. Well done. I have a non-verbal 14-year-old that I can send from upstairs to downstairs, go inside my handbag, bring out my tissue, and he'll bring it. I'll just be hailing him and say, yay, that's my star boy. Like, he's completely non-verbal, but he's able to go on very good errands for you that even the verbal ones are not able to do. But because we've consistently used clear communications and expectations, he knows that we expect him to do. That's another thing. Most times our children don't do so much because we don't even us, even as a professional, I'm saying, talking to myself too, most times we underestimate them. Yeah, because the excitement we show when they respond to certain things makes me feel like, oh, okay, true. I didn't actually think that this child could do this before, but the child is able to, and then you're shocked. So when children understand that you expect them to, when they understand that you have that expectation, they tend to want to meet your expectation. But if they know that, you wouldn't even want me, you anticipate their needs and you meet it. So there's no need for me to want to even try, because who doesn't want the soft life? Me, I want. If I can sit down and then somebody will bait me and I stretch and you do everything for me, I'll be cool. But if I know that you expect me to do certain things by myself, I would make effort to do it. And that's how it works with our children. After a while, you see them doing things that society or even us actually thought they would not be able to do. So we should learn to use clear communication and build expectations that the child knows what to expect, and then not in helping the child get the child to a state of what we call learned helplessness. Learned helplessness is where I don't even bother doing anything because I know that you're going to do it for me. Not because I cannot do it, but because I have learned not to do it and I have chosen not to do it. So that's how it is. And then respect routines. Don't just come out of nowhere and decide, oh, we used to follow this road every day. Why will you? No, we follow this road every day because of child B. And then why won't he understand? Let's follow like this. And then the child throws a tantrum and you now blame the child for behaving that way. Meanwhile, you didn't respect routines and the child's routine and follow it. Then create inclusive spaces. Spaces where autistic people can thrive. You're making rooms, creating calming corner where they can go take a break, where they can go calm themselves down, and you're not enforcing things on them. There are a lot of spaces that are very, 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 very intrusive. Even me, that is seemingly neurotypical, there are some noises that you hear and then it gets to your ear, and then, like, I cannot tolerate the sound of dragging metal through a very rough surface. You know that creaking sound it makes? Like, I can literally have goosebumps on my body as a result of that. So imagine a child with autism that is hypersensitive to sound, dealing with that is hypersensitive to smell, dealing with 50 people in a room with different the perfume, the toilet, the bus conductor, all the eels you can think of mixed together. How overwhelming it can be for the child. So we should put that in mind when we're creating spaces for them, so that they are able to fit in and not just be one out of the box. So how do we support children? Oops, it moved. Now we won't go back again. Sorry. Please, where I'm trying, this is supposed to be 1 hour if I'm not mistaken. So I'm trying to be as fast as I can. Please drop your questions. Don't forget them so that I would address it at the end. So I'm coming. Okay, slide show back. So supporting children, early intervention matters. Once you see something, do something. The advice now is don't wait it out. Don't wait to put a name on it. If you see something that is not working, seek help, ask for clarifications, get good and qualified people to work with your children. Don't just toss your child to anybody on the streets. Then use structured teaching. Okay. We had a webinar at 6 to 8 that just ended, and then we talked about intentional parenting. In this day and time, we're telling parents to be more intentional about parenting. You have to be intentional in parenting any child, even more intentional in parenting a child with autism. So you have to, the resource materials, all of that has to be in place so that the child follows that structure. You know, we said something at the other slide that they like routines and structure. So use structured teaching to teach them, and then you'd be shocked at what they can learn. Positive reinforcement. Oh, good job, well done. You did a great job today. So they're excited when they hear that. Oh, and then it's not just social praises like good job, well done. There's still the tangibles for the younger ones most times, but the older they get, the more we tilt towards social praises. And then over time too, you fade it off, because who writes one and then you say good job? I write, like as I'm talking now, I say early intervention matters. Miss Rosemary says good job. Use structured teaching. Good job. No, the world doesn't work like that. But over time, you build on it till the child gets to the point where reinforcement no longer matters. So positive reinforcement. Then work with professionals, okay? Ask questions. You have a child with needs, ask questions. What qualifications do you have to work with my child? What's your experience like? Be detailed. Don't be quick to just give a child to just anybody. Then still back to autism in Nigeria, there's growing awareness. Cultural misconceptions still exist, and that's the truth. People still think that autism is as a result of one, especially when the child acts up in a religious setting, it's as a result of one demon that is take the child to somewhere, let them plug the autism out of the child. So it still exists. We're still pushing for more awareness, taking awareness to the rural settings, because it looks like it's more of in the urban setting where people are more aware and seek for help. But autism exists in the rural settings. They are there. It's just that a lot. We don't have a lot of data in Nigeria, but a lot of children go undiagnosed. So there's still need for advocacy and support for people to come out and talk about it, say what their challenges are, to say what needs supports, even the ones that have children with needs, to get adequate treatment, adequate care. They don't. Sometimes they don't even want to come out because they don't even, where do we start from? And it's not really cheap, because it's not cheap per se for you to get good service, because it takes a whole lot into getting certified trainings and all of that. So it's not particularly cheap for the average Nigerian as we know how the country is, but there's need for advocacy and for support so that people that are not able to get these services can get it at discounted rates or at no rate at all. So real life impacts. Every child can grow and every child can learn. Every child can learn, and that's the truth. Every child, because I've seen, and I know that there are colleagues here that have seen children that were brought to them at almost next to nothing. And then you see the child doing things. Okay, it just takes a lot of time, more time than it will for other children. But will the child learn? The child can and will learn. Progress is possible. You know, at the beginning, I said, impossible is impossible. Okay, impossible is impossible. It's impossible. Like there's no two ways around it to say that it is not possible. It is very possible. And support changes lives. A lot of support changes life. And it's not just for the parents. It's not just for the children, rather, for the parents, for their family. They need to know that they have people in their circle that understands them, that understands their child, and that wants the best for their child. And they are not quick to actually judge or condemn them because of a child that they have. So support goes a long way. So how would you support a non-speaking child? Think, share, discuss. I'm looking at the comment section now. The chat button is open, so I'm waiting. So drop in the chat button box. How would you support a child that is not communicating, that is not speaking? How would you do that? I'm waiting for your responses. Miss Rosemary, hope I'm trying.
Yes, very much so.
I'm
Okay,
checking time, don't worry.
okay, would this be the end of your slide? You done giving us all that you have in you?
Okay, so next is just questions out.
Okay. Wow, amazing.
I'll just look at the key takeaways. Okay, autism is a spectrum. Everyone is unique. Understanding leads to acceptance. And what's the call to action that we should all leave here with today? Learn more. This is just a scratch on the surface that we just did today. It's not as deep. And be inclusive, support families, and then speak against stigma. If you see a child at the bus stop that somebody's talking to anyhow, you can. There's a mother that used to tell me, calm down, calm down. I would almost want to go and fight. What are you looking at? What is it? You have not seen a child before, or what is your problem? So speak against stigma, support families in any way that you can. If you see a mother that is overwhelmed and then you have that free time, can you come keep your child with me for 1 hour while you take a short nap? Can you keep your child with me for 2 hours and then you just sacrifice that for that parent to rest, because trust me, it's a whole lot handling a child with autism. Thank you, thank you, thank you, thank you. So let's keep the conversation going. Your questions are at this point welcome. Thank you.
Wow, amazing. I'll just give you a clap from here. Thank you so much, Mr. Kaude, for that. This is amazing. I mean, I know that with this disorder, we do not have so much across Nigeria. It's just in some urban parts of Nigeria like Lagos and all, and it is an a wonderful privilege to have you here. Thank you so much. Now this is the time for questions and answers. Yes, because our facilitator is still on ground to answer our questions. And you can also tell her thank you because she has done an amazing job. Like she said, that this is just surface level of what ASD actually is. But we know that with what she has done, it is amazing and it's something that we can go by. All right, so I have so many questions from my end. and I will start dishing it out to you. And I'm going to start with this one. You, I'm supposed to take it from the beginning, but I'll just pick one question randomly. So you've explained what ASD is and how it is, in relation to people, children, growth, and growing up to be adults. And you also used yourself as an example. You said, and I quote, just roughly, that even you, as a neurotypical person, you also like have sensory reactions. Let me put it that way. Now, I want to ask because this is something like is usually said everywhere, or some people in some spheres and some spaces, that caregivers for autistic children also behave like their children. Yes or no?
It's it's not a yes or a no answer.
Okay.
It's not because it's you can't say they behave like them. You get to we live this life literally every day. I see these children every day, except Saturdays and Sundays, right? So there's every tendency that some things might rub off, okay? But it's not, I don't think it's as a result of like my own experience or my own sensitivity, right? It's not as a
Yes.
result of my interaction with the children. It's not, autism is not contagious.
Hmm.
It's
Okay.
not contagious. So I didn't get it from them. It was there, but got heightened. I got older and it became more obvious, or I understood what it meant better. We all have things that that you cannot even
Well,
say in public. You don't have, you can't say it, right? But you have things that you can do inside your house that you cannot do in public. That's because you understand that it is improper in public, but it does not change the fact that you do it either ways. So basically, that's how I'd look at it.
okay. All right. Thank you. So we have some questions in our the comment section. Please do check drop your questions, and I'll be reading a question from one of a member of the audience, and Great Impact. Well, that's the name. Is asking what he or she can do, what they can do to a child that always wants to control, love playing, and they try to bring this child to work after playing, but he will always refuse. Okay, please, I'll just skip on this first of all. But before I go to other questions, I'd like to ask first of all, after giving us how we can identify or signs of autism in a child, especially for children growing up, is there a way we can get a professional diagnosis? Like, how you go to the hospital using even malaria as a case study. You have the symptoms, you have fever, you have headaches, and then you still need to go to the hospital to get a diagnosis. So how do we get an official diagnosis for ASD? Or it's just when I see a child looking from the side of their eye, or have toe walking, tiptoeing. How do I get, an official diagnosis from the
Okay,
doctor?
when you go to the hospital, most times the doctor cannot look at you and give a diagnosis. Okay, there are tools that are used. Okay, and then it could be behavior specialist, developmental specialist that is trained for diagnosis. Okay, and then you have an official diagnostic report. So it is not just by these symptoms you. So but I didn't mention all of this so that you now start self-diagnosing any child that you see on the road. This is what they showed us. They talked about that day. This is looking like autism. Oh. No, that's not it.
Mm.
If you know anybody that has symptoms or anything that looks like it, just direct the person towards seeking help and getting professional help.
Okay, thank you. Thank you so much for that question. I have another question here. We've also mentioned you've given us different myths. You've busted so many myths in relation to autism, but there is one particular one that keeps cropping up, when people say, and it looks like there's also an advocacy on that. Some people say that vaccines cause um autism. So when they take their children to the hospital, they are beginning to scrutinize every vaccine the children is giving them because they feel like at a particular stage the children are getting vaccines, all the vaccines, BCG and all of that. So somehow they have gotten a vaccine that would, later relate to ASD. How true is this?
There's, as at now, I don't know, science and evolution, Abby, and everything changes. In the next 1 hour,
Mm-hmm.
there might be a report. Maybe somebody is investigating it now as we speak, and then in the next 1 hour, it is confirmed. But as we speak, there's no proof that vaccine causes autism and which vaccine causes autism. It's just like they say, oh, it's been linked to genetics, but which of the genes they don't know because there are a lot of there's a lot of gene. Okay, there are lots of genes, right? And then they don't know which one. So that's the same thing with vaccine. A lot have so we're doing a pre-consultation with parents. We tend to ask, at what point did you start becoming, at what point did you, especially when it's regressive autism, where the child was talking at some point and they started losing skills. They tell you, okay, it was at 18 months. Sometimes they did not even take the vaccine. There are lots. So what happened if you say vaccine causes autism? There are parents that did not give vaccines and the child has autism. How do you now prove that? So it's not a given. I am not saying that tomorrow it might not change or in the next 30 minutes it doesn't change. Yeah, so nobody quotes me out of context. But as it stands now, there's no proof. There's no research proof that vaccine causes autism.
Okay, thank you. So you can also raise up your hands if you want to ask your question. You'll be given the virtual mic to speak. But right now, someone has risen up their hands, and that is Aisha. So please unmute and speak. Thank you.
Thank you very much. Good evening, all. Madam Ugo, you've done a good job in dissecting the subject of autism tonight. I want to find out what is the correlation between dyslexia, right? And what awareness is going on in Nigeria, particularly regarding autism. Myself and my wife were listening to the conversation earlier, and she said those days people use cane to knock out autism from people's head. So there are a lot of people still in this practice, maybe in rural areas. So what awareness do you want to create by this section tonight? What message should we be spreading out so that people can be better enlightened, particularly those that don't have the privilege of being here tonight? Thank you.
Okay, thank you. Thank you, sir. Autism and dyslexia are two different neurodevelopmental disorders. They are not the same, but sometimes they can overlap. A child with autism might be dyslexic, but there are two different diagnoses. Dyslexia has to do with words and letters, challenges with reading and all of those, where autism is a different diagnosis on its own. So they are not, it's just like sometimes we would say that autism does not work alone. It's like siblings. So you see autism and seizure. I've seen autism and cerebral palsy. So you see all of those together, but it's not that it's not there are two different diagnoses on their own. They are not exactly the same thing. And then your second question was about when flogging autism out of children. So those are ways that people felt was working, but maybe it worked for one or two children, but did not felt like it was a general means of addressing it. There are children that if you hit them now, they will bring their hand tomorrow for you to hit them again. So imagine flogging that child to flog autism out of the child. You're going to keep flogging. You know how all those stubborn children in school just set bomb and then you flog. Your hand will pain you, you stop. So it doesn't help. It doesn't help. If anything, it actually even aggravates issue, because if I'm very, very hypersensitive to touch, and then you flog me, you need to really, really flog me for me to feel it. I would have to do what you don't really like so that I can get that flogging that gives me the feeling that I want. So you see that you're increasing bad behavior by flogging and not actually helping the matter. So how do we want to, is at the end of the day, how do we want to create awareness? Is each person tell the other person, direct to right places to learn, like I said, read more, and not everything, because like we know that Google has a lot of information that would make your head actually go crazy. And then a lot of wrong information as well. But seek for information from the right places. Ask questions when you see gatherings of stuff like meetings like this, talking about what is of interest to you. Of course, go there. We have this month of April, a lot of organizations are doing trainings and webinars, and most of them are actually free. A lot. The one I was part of this at 6 is a trail for 5 weeks, and we're looking at autism from childhood to adulthood. We're looking at plans for the workplace, plans for job, plans for marriage, procreation, all of those. So there are lots and lots of trainings and expositions around autism. So, and then the workplace too, people need to know and all of that. So I don't know if I answered your question correctly, sir.
Yes, you answered correctly. Recently in the news, there was a case, I believe, of an autistic young man who was given out in marriage in a popular church. How do we, ensure that such things don't happen and these categories of persons are not taken advantage of in the name of whatever it is called?
The funny thing is, Nigeria is what it is. There's as little as one can do. And that's the truth. You can only talk in your corner or say what you can, but do they deserve to get married? Yes. Do autistic need to get married? Yes, because they get older. Autism does not affect the reproductive organs. They would have erections. They would masturbate in your presence. I've seen that not once, not twice. 18-year-old, 19-year-old, 20-year-olds, because they don't understand. But the hormones are raging. Autism does not affect it, right? So, but do they need to learn to have sexual intercourse and all of that? Yes. But it's how it is managed. Unfortunately, in this part of the world, we do not have control over a lot of things because there are little or no regulation. You'll be shocked that in the whole of maybe Lagos State, you don't even have one inclusive school that is owned by the government, not private school, inclusive school, not special needs school, inclusive school or special needs school. You can count, I'm not sure you would count up to 5 fingers, right? So it means that there's people in the private sector are allowed to do what they feel is good enough because there's nobody, and then the alternative, the first choice, which is supposed to be the government, has little or nothing to offer. So there's as much as you can do. So you just do what you can within your own circle to ensure that there's inclusion, there's support, you support those around you, and ensure that they know that they have you as part of their circle that supports them and not just being there on their own.
Thank you, ma'am.
You're welcome.
Wow, thank you for that. I was also going to ask in relation to autism and adulthood. Well, that's a part I would have loved to ask. But before I go, the questions that are streaming in, I would like to also remind you that YP-LEF is a session that happens fortnightly. That means that we meet every 2 weeks here with topics that make a holistic young professional. And I have it on good authority that I can see that we have people who are joining us for the very first time. We're glad you're here and would also like to know where you are joining from. So you can also leave that in the comment section, your name and where you're joining from. We love you here. We'd also like to remind you that we have other social media accounts that you can, just watch. We have our YouTube page that you can go on and go back to previous topics that we've had and covered in months, in years actually. Okay, so I have a little question here in relation to autism and adulthood. Rather unfortunately, we have had little diagnosis, especially for children who have become adults, say 80s, even 90s and early 2000s. And we have such people in our society right now, even sometimes in in professional settings. So what is in place? You've talked about how to help children, give them one step information to get things done and all of that. How do we help even those in adulthood? Because like you said, we cannot diagnose from just visuals. So how do we help? Can these people also grow up to become or hold positions in society? I think that's a two-in-one question.
Sorry, I don't think I got it correctly. Can you go through the question again, Miss Rosemary?
All right, so we have people who are adults in professional settings, and we
Mm-hmm.
obviously cannot diagnose visually. So the number one question is, can people, obviously we've not there's been no diagnosis, say from 90s, 80s, and far back now. So we've seen people behave somewhat in our settings, but from explanation, it looks like they have autism, even though you've advised that we do not, give them diagnosis by ourselves. So, how do we help these people? Because we do not know what spectrum they fall under. And then, can autistic children go up to, hold positions in society?
Okay, so I'll start with the second question before going to the first one. So when we're having this first conversation I had earlier on today, we said we're talking about autism in adulthood and job, and somebody was asking, is it okay to declare when is it okay to declare your status to say I have or I don't have? So it's person-based, right? That was the response, yes. Experience-based, because imagine in the workplace and with little, you know how unemployment is high in Nigeria, and then you're quick to say, I have autism. If you had 80, even if you could do the job, chances are you're not going to get it. The first thing you would hear is, people that are okay first have not gotten it, is you. So, but there are other places where your diagnosis gives you a higher chance of getting it. So we know part of the world is peculiar. So it's not impossible, but it's just difficult. That's the way I'll look at it. It's not impossible, but it's just difficult, depending on the level of functionality of the child. So that's it. Then the first question you asked about, how do you help an adult that shows sign, an undiagnosed adult rather, that shows signs of autism, but is not in the workplace, but it looks like something is not adding up, is be more understanding, be more empathetic, give room for errors, support, and then basically that's it, to make the space more comfortable for the person. Yeah, that's it, Miss Rosemary.
Okay, thank you. Oh, I see so many people joining in from Port Harcourt. Thank you so much. We are glad that you have joined us from the oil city, down to Lagos. All right. One more question. You've also mentioned how that from the last question asked how we can advocate for, for autistics. Now, I have this question. You also mentioned at the beginning that we're not supposed to use word like normal. So how do we act, or how do we say, or what should we stop saying or doing around autistic people?
Anything that makes them uncomfortable, you can't use their diagnosis as a joke. There are certain jokes that are not funny to me. You can't use like using someone with Down syndrome to create a joke. It's not funny to me because why? Why would I want to laugh? Why are you laughing as a result of someone's predicament, right? So there are certain things that will come out as a joke. So don't joke about their status. Don't talk about what is, don't say things that are not, oh, why are you flapping like this? Why there's certain things not to do around them. Like I said, if you're empathetic enough, if you're empathetic, you'd be able to control yourself and not do things that if it was you actually, or if you were in their position, how would you feel? So being empathetic means putting yourself in their position to think how you would feel if someone else does the same thing. So if you do that, you'll be able to not do certain things around them, I think.
Hey, that's I think, that's amazing answers, right? And I would also like to think that even with us neurotypical, if I'm correct with the term, and then later I'd also like you to express or say the meaning or the difference between neurodiversity and neurotypical. So even with us as non-autistics, there are also some certain jokes that are not funny to us, and some people make them. And we have this expression that, okay, what is that?
Not
So
funny.
definitely we can relate to them as well. So can you just say the difference between being neurotypical and being neurodiverse?
Sorry, can you come back again?
The difference between neurotypical and being neurodiverse.
Okay. Neurotypical means seeing the world from, how do I put it? I'm trying to to be as plain as I can. So it doesn't come out complex, right? So neurotypical means I'm processing it the way neuro, brain, right? When we hear neuro, it means it has to do with the brain. So it means it is as it should be, neurotypical. I'm processing it, I'm taking it in, I'm processing it the way it is supposed to be. Neurodiverse, this is me saying it in plain language, right? Neurodiverse means it's not your regular way. It's different. I process it differently from how you usually process it. The way I take it in is different from how you take it in. The way you hear some people say this, they smell colors, right? They smell colors. So, and they know it, they perceive it, and then they tell you this color blue. I don't know how that works actually. But it is what it is, and then you can't take it away from them. So that's how, when I said how I would actually explain autism is seeing the world and experiencing the world differently from the way the world seemingly would see it. So that's what neurodiverse would be.
All right. Thank you so much. Thank you so much, Miss Ukaude, this has been a most enlightening session. If you agree with me that this is, more educating, that you do really have it, you can just leave that in the comment section. Even as we draw a curtain on tonight's episode of YP-LEF. Once again, YP-LEF is a fortnightly session. So we have various topics. We have seasoned facilitators like we have Miss Ukaude here tonight. So we take different topics, health, finances, so many things. And for the next session, we are also talking on something about marriage, and it is navigating life before and after I do. So it's not just about running to the altar and just saying, yes, I do. What happens before and what happens afterwards? So I just like you to say however you want to appreciate our facilitator for coming here tonight and dishing us with this engaging and interactive and educating session. Thank you so much, Miss Ugo rather, Ukaude. Thank you so
Thank
much.
you, Miss
We are
Rosemary, for
delighted to have you
having
here.
me.
And we have seen that we have a community of your people here on ground. Thank you so much for also joining us. It is our pleasure that you are here. So before we close the curtain,
Please, someone said, please, my question is not answered. Can you scroll through and look for the question, please?
okay, I believe that would be a question. I do not know if it's a question on autism.
Oh,
Okay,
okay.
yes, he's asking for a child that wants to control, that loves to play, and he brings the child to work, but always refuses to do what he can do. The child is 3 going on 4. Okay, let me allow you answer.
Okay, so I would say build a structure, create routines around it. So create reinforcers. If you do this, you get this. Okay, so you want to play, before you play, you get to do this. When you're playing, after playing, you do this. So when the child is playing, you're already telling the child, you're timing the child. Okay, you're prepping the child towards, oh, in 5 minutes, in 10 minutes, we're going inside. Oh, in 5 minutes, we're going inside. In 3 minutes. So the child has what to expect, right? It's not just you're not playing, let's go inside. You remember we said our children thrive on routine and structure. If there's no structure, there's chaos in their life. So that's when you see all those yucky behaviors that you don't like, because there's no structure. If you create the structure, you see less of the tantrum. So create a structure to say, okay, it could, most times visual actually. You do this, after this, we do that. So if the child wants to deviate, you draw the attention to it, say, remember we said, what did you say we're doing now? After that, especially when the child is very verbal, even if the child is not verbal, use visual cues to teach that. Say, remember we said we're doing this. After this, what are we doing next? The child points to the next step. After that, what next? So the child knows what to expect and is better able to regulate, and you have less tantrums. I hope we've answered your question. I have answered your question.
Yes, I believe you have done that, because I think this is also something that happens with most, in quotes, Nigerian or African parents. They just say, go do it. But the recent, quote again, generation of children begin to ask why. Why are you asking? Why are you telling me to go inside? Go inside. Why are you telling me all of that? Okay, so thank you very much for explaining that. And thank you, Great Impact, for asking that question as well. All right, we'll invite our grand patron to also give us a closing remark on this session that we've had so far.
Thank
Uh,
you very
okay.
much, Mrs. Hugo. This tonight has been very, very lightly and very, very gentlemen. Would be you school here in Lagos, getting to understand that part visited Emily has 3 children who have this challenge. And I tell you, it's a lot of money to get people going on, with good to these people. Let's identify with them. More hands be able to also help financially. We can make our society better by whose challenges are not actually what they can identify. We on a sideline, we can find out so that we have less of these, so that people can have more of people who are normal, and then they will be able to enjoy life better. Thank you for everyone who have been a part of this tonight. God bless you all.
Thank you very much, sir. Thank you. So before we go, we'll just wrap up with a brief moment of prayer. Father, we thank you for this session. We thank you for opening our eyes. We thank you for also now giving us the wisdom as we go out into our different spheres, locations. Help us to know that with what we have learned, the new knowledge that we have, we're able to also help those with this challenge around us in Jesus' name. And we pray also for our facilitator, even as she's helped us and taught us. We also ask that you replenish and help her with her growth as well in Jesus' name. Thank you, Father,
Amen.
because we know that you have answered. For in Jesus' name we have prayed. Amen. Thank you so much, everyone, for joining.
Amen.
We look forward to seeing you again in 2 weeks. Thank you and have
God
a
bless
good
you.
night rest.
Thank
Thank
you. Bye,
you. Bye bye.
everyone.
Yeah.